Dry eye syndrome is a common condition that occurs when your eyes do not produce enough tears, or when the tears they make are of poor quality and not working properly. Contrary to what many people assume, dry eye isn't usually caused by not producing enough tears. It's often about producing poor quality tears that evaporate too quickly or aren't distributed properly across the eye surface. Your tears aren't just simple water droplets. They're actually a complex mixture made up of three distinct layers: an outer oily layer that prevents evaporation, a middle watery layer that moistens the eye, and an inner mucous layer that helps the tears stick to the eye surface. This three-layer tear film coats the surface of your eye each time you blink, providing essential moisture and nutrients to the cornea, while also helping to clear away debris and protect against infection. When any of these three components is off, your eyes can't stay comfortably lubricated. Over time, this leads to inflammation, damage to the eye's surface, and those familiar gritty, burning sensations. Dry eye syndrome represents one of the most common reasons people visit eye doctors, affecting an estimated 16 million Americans and millions more worldwide, with the prevalence increasing with age. Types of dry eye syndrome. The two primary categories are aqueous deficient dry eye and evaporative dry eye, though many people experience a combination of both. Aqueous deficient dry eye occurs when the lacrimal glands don't produce enough of the watery component of tears. This type accounts for about 10 to 15% of dry eye cases. Without sufficient aqueous production, the eye surface becomes inadequately moisturized, leading to friction, inflammation, and discomfort with each blink. Evaporative dry eye, on the other hand, accounting for approximately 85 to 90% of cases, happens when tears evaporate too quickly from the eye surface. This most commonly results from meibomian gland dysfunction, where the oil-producing glands along the eyelid margins become clogged or don't function properly. Without adequate oil in the tear film, the watery component evaporates rapidly, leaving the eye surface exposed and vulnerable. Symptoms of dry eye syndrome. Dry eye syndrome comes with a range of symptoms that can be mild at first, but often worsen over time if left untreated. The most common feeling people describe is a persistent dryness or scratchiness in the eyes, like there is something gritty or sandy stuck under the eyelids. This sensation can become constant and incredibly distracting. Many people experience burning or stinging in their eyes, which can be made worse by windy conditions or air blowing from a fan or vent. The appearance of the eyes often changes with chronic dry eye. Redness along the white of the eye, called conjunctiva, results from inflammation and dilated blood vessels responding to surface irritation. The redness may be diffuse or concentrated in certain areas, typically worse toward the end of the day. In severe cases, the cornea may develop visible changes, appearing dull rather than bright and clear. Another frustrating symptom is blurry vision, which may improve when you blink but returns quickly afterward. This happens because the tear film that keeps your vision clear becomes unstable when the eyes are dry. Sensitivity to light, also known as photophobia, can make it uncomfortable to be in bright environments, making outdoor activities or working under fluorescent lights difficult. Ironically, watery eyes are a frequent symptom of dry eye syndrome. This reflex tearing occurs when the eye detects dryness and triggers the lacrimal gland to produce a flood of tears. Unfortunately, these emergency tears lack the proper composition for effective lubrication and tend to spill over the eyelids rather than coating the eye surface properly. Many patients report episodes of excessive tearing following periods of significant dryness or when exposed to wind or bright light. Causes of dry eye syndrome. Dry eye syndrome can happen for a variety of reasons, and in many cases, it is the result of several factors working together. One of the most common causes is the natural aging process. As we get older, our tear production gradually decreases, making older adults more likely to develop dry eyes. Hormonal changes, particularly in women during pregnancy, menopause, or while using birth control pills, can also reduce tear production and affect tear quality. Staring at digital screens for extended periods without blinking enough is another major contributor. Blinking spreads tears evenly across the eyes, and when we focus on screens, our blink rate decreases, allowing tears to evaporate and causing dryness. Environmental factors play a huge role as well. Spending long hours in air-conditioned or heated rooms, exposure to wind, smoke, or dry climates can all speed up the evaporation of tears, leaving your eyes unprotected. Certain medications, like antihistamines, antidepressants, decongestants, and blood pressure drugs, are also linked to dry eyes because they reduce moisture in the body, including in the eyes. Other than these causes, numerous health conditions are directly associated with dry eye development. Thyroid disorders, particularly Graves' disease, can cause inflammation of the eye tissues and affect tear production. On the other hand, diabetes can damage nerves that control tear secretion, while skin conditions like rosacea and blepharitis cause inflammation around the eyelids that impacts tear quality. Lastly, eye surgeries, such as LASIK, can sometimes damage the nerves that signal your eyes to produce tears, leading to long-term dryness. Diagnosis of dry eye syndrome. Diagnosing dry eye syndrome begins with a conversation between you and your eye doctor about your symptoms, lifestyle, and medical history. The doctor will want to know when the symptoms started, how severe they are, and what seems to make them better or worse. During the eye exam, the doctor will carefully examine the surface of your eyes using a special microscope called a slit lamp to look for signs of dryness, inflammation, or damage to the cornea. One common test used is the Schirmer's test, where small strips of paper are placed under your lower eyelids to measure how much moisture your eyes are producing over a few minutes. Another test might involve applying a fluorescent dye to the tear film and measuring how quickly dry spots appear after blinking. These dyes make it easier for the doctor to see how well your tear film is covering the eye and whether there are any damaged cells. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for dry eye syndrome. Number 1. Artificial tears and lubricating eye drops. These over-the-counter drops are the first line of defense for mild dry eyes. They work by adding moisture and mimicking real tears, but not all drops are the same. Some contain preservatives to prevent bacterial growth, which can irritate your eyes if used more than 4 times a day. Preservative-free versions come in single-use vials and are better for frequent use. If your dryness is due to evaporative issues, like meibomian gland dysfunction, look for drops labeled lipid-based or oil-based, which supplement the oily layer of your tears. Gel-based drops are thicker and last longer, but they can blur vision temporarily, so they're often used at night. Number 2. Prescription medications. When over-the-counter drops aren't enough, your doctor might prescribe meds. Cyclosporin, or Restasis, and Lifitegrast, or Excedra, are anti-inflammatory drugs that reduce corneal damage and boost tear production. They take weeks to work and can cause mild burning initially. Steroid eye drops, like loprednol, are used short-term to calm severe inflammation, but aren't safe for long-term use due to side effects like glaucoma. Antibiotics like doxycycline or azithromycin might be prescribed if your dry eyes are linked to meibomian gland issues. They reduce inflammation and improve oil secretion. Number 3. Punctal plugs. If your tears drain too quickly, punctal plugs can help. These tiny devices, made of silicone or collagen, are inserted into the tear ducts, called puncta, in your eyelids to block drainage. This keeps your natural tears on the eye's surface longer. Plugs are reversible and can be removed if needed. For severe cases, doctors might permanently seal the ducts with a procedure called cautery. Number 4. Warm compresses. For evaporative dry eye caused by clogged meibomian glands, daily warm compresses can melt thickened oils. Use a clean, warm washcloth or a microwavable eye mask, heated to a comfortable temperature, and hold it over closed eyelids for 5 to 10 minutes. Afterward, gently massage your eyelids with your fingertips or a cotton swab to push out the softened oils. Clean your eyelids daily with a mild, non-irritating cleanser or baby shampoo to remove debris and prevent gland blockages. Number 5. Lifestyle changes. Small changes can make a big difference. Use a humidifier to add moisture to dry indoor air. Position computer screens below eye level so you don't have to open your eyes as wide, which slows tear evaporation. You should also follow the 20-20-20 rule. Every 20 minutes, Look at something 20 feet away for 20 seconds to reduce screen strain. Wear wraparound sunglasses outdoors to shield your eyes from wind and dust. Stay hydrated, eat omega-3 rich foods like salmon, flax seeds, or walnuts, and avoid smoking or smoky environments. At the end, while dry eye syndrome is usually chronic, there are many ways to keep your eyes feeling comfortable, clear, and healthy every day. Now, we want to hear from you. Have you ever struggled with dry eye syndrome? What symptoms bother you the most, and what treatments have actually worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.